Can your rheumatologist still help if your imaging looks normal, but you still have pain? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Okay, you've been referred to a rheumatologist because you have some symptoms, let's say pain. Your rheumatologist gets some imaging, let's say some x-rays, maybe they get an ultrasound, maybe they get an MRI. They're looking for a specific cause for your pain. Let's say your images come back normal. What do you do? Can your rheumatologist still make a diagnosis? Can they still help? Short answer is yes, it's still possible. They still, however, need to come to a diagnosis. Understand that pain can come from a lot of different causes. We'll break that down to help guide you here. Now, part of this is that you could have a structural issue, and imaging can be helpful. Let's say you have bad arthritis of the knee. You get an x-ray of the knee. Does it show arthritis or not? Okay, well, if you have significant arthritis, it will likely show up on the x-ray. There's a couple caveats here. Number one, maybe your arthritis is not advanced. Maybe it's mild to moderate. It can still cause a significant amount of pain. That may not show up at the same level that it does on an MRI that it would on x-ray. So did they get the right imaging modality? Maybe they needed to get a more advanced imaging modality to help make that diagnosis. Alternatively, you could still have a structural issue, but perhaps it isn't a cartilage one. Right? So an x-ray would not necessarily show a ligamentous injury. It can sometimes show some gross instability, but usually it's not going to show a partial injury or even a full tear sometimes. You normally need to get advanced imaging like an ultrasound or an MRI in that case. And then lastly, it's possible that you could have a structural problem and the imaging report just is not correct. Ideally, your ordering physician should be looking at the images. Ideally, that doesn't always happen. It's not always available. But sometimes a busy radiologist may miss a mild degree of pathology that's been detected on the imaging if they don't know what they're looking for or if they're not taking the full amount of time. The next is maybe it's the wrong imaging modality for the diagnosis. So if you have inflammation, x-rays, unless you have really advanced long-term disease, x-rays usually will not show the classic findings of chronic inflammation. Diagnostic musculoskeletal ultrasound and MRI can definitely show inflammation, whether it's chronic or acute and short-term and newer. And so it's possible, if they're looking for inflammation, that the wrong modality has been checked. Understand that x-rays are typically and frequently the first-line imaging that are checked by rheumatologists, in part because that's traditionally what's been done for many decades, in part because it's quick and easy to get those done as well. But if you're looking for inflammation, it's just not the right modality. The right modality is ultrasound and MRI. The one exception could be if you're looking for inflammation in the sacroiliac joints. Generally, x-rays are the first-line thing to check. Quickly thereafter, if it's not showing anything, to then get an MRI. Another aspect to this is that as rheumatologists, we have come to understand over the last 10 to 15 years that there are versions of inflammation in the joints that don't show up classically as you would expect on imaging, even advanced imaging like ultrasound and MRI. This can be a bit challenging for patients to understand. Frankly, it's even challenging for physicians to understand and even sometimes rheumatologists. Why is it that if you think somebody has inflammation in the joints, but their imaging comes back negative, that they could still have inflammation? Well, there is a diagnosis called non-radiographic spondyloarthropathy, which basically means you have all the features of inflammatory back pain like ankylosing spondylitis, but you do not have the classic imaging finding on X-ray or MRI. Frustrating, but there is good proof and data to show that that is in fact a legitimate entity of inflammation in the spine that can present even if your imaging is negative. So sometimes the imaging just doesn't show up because the imaging is not quite advanced enough, even advanced MRIs, that it's possible the science and technology is not quite advanced enough to fully catch 100% everything. In addition, there are diagnoses of pain that are not inflammation and that are not structural issues. For example, let's say you have a nerve issue that's causing pain. Let's say there's concern that you may have a pinched nerve in the back. Well, checking an X-ray, checking an MRI certainly makes sense to look for that kind of structural issue. Usually that will show up. Rarely, on occasion, it might not show up. There are other types of diagnostic tests, like an EMG, a nerve conduction study, where you can look to see if a nerve is irritated or pinched. Again, it's not 100% positive, all right? Really, there's no test that's 100% positive in medicine. There's always a couple gaps here and there. There may be a couple things that are overly sensitive, a couple things that are undersensitive. So there's nothing that's 100%. If you have some findings, let's say on your examination, that are consistent with neuropathic pain or neurologic cause, even if some of the additional testing is negative, you still need to consider whether that could be a diagnosis. And then lastly, there's other causes of pain as well. As example, instability, hypermobility, even EDS, Ehlers-Danlos syndrome, does not typically show up on imaging as you would expect. There are some exceptions to this. On dynamic motion X-ray or sometimes dynamic ultrasound, you can sometimes see some significant instability in a joint that could explain why somebody has pain, namely hypermobility or instability. But again, that's not 100%. So imaging in someone that has, let's say, classic examination findings of instability on exam can sometimes be your trump card and sometimes could explain why imaging might be negative, but clinically on exam, they still have instability, that you would still make that diagnosis. And then lastly, there are obviously other things that can cause pain that have nothing to even do specifically with the joints. And that can include things like if your thyroid is underactive, if you're low vitamin D, low B12, or if your cortisol level is not at a high enough level, meaning you're adrenally insufficient. All those things can also cause pains. If your hormone levels are off, let's say your testosterone level, or if you're perimenopausal or menopausal, again, those are other things that can cause generalized pains as well, even if you have normal imaging. So imaging is a key part of what a rheumatologist or a physician will look for if you have pain. But even if your imaging is normal, there are other reasons why you could have pain, and your physician should make an attempt to try to figure that out, to help make a diagnosis, to help guide you, and to help treat you so that you're feeling better and getting back to an active and quality of life that you deserve.